Hello, viewers. Welcome to the Health Breakdown. I'm still your host, Michael Arinze. Today, we are going to be talking about antibiotics resistance. Just like every other complication in the health sector, antibiotics is one of the most critical aspects that one should look at. Do you know that over 5 million individuals die per annum because of antibiotic resistance? This is more than what malaria and HIV have killed altogether annually. Statistically speaking, somebody can be asking, what is this antibiotic resistance? How can it be that deadly? So before then, what is antibiotics? I'd like you to know that antibiotics, just like the name implies, is a drug that we take against what? Bacteria. We take this drug to inhibit or kill what? Bacteria. But oftentimes, bacteria grows what? Resistance to this what? Antibiotics. It now tends to fight back. These antibiotics cannot be able to what? To kill or hinder them again. So when that happens, situations are critical, lives are threatening because a particular bacteria have now grown resistant and is now combating with antibiotics that you do consume. But there are critical things or situations that have triggered this process in the human body. What are the causes of this antibiotics resistance? Number one, overuse of antibiotics, wrong use of antibiotics. You don't take antibiotics because you see where to buy it. You don't take antibiotics because you can afford it. Wrong use of antibiotics. A good number of us, when they are done with malaria, what do? They go to a drugstore and get an antibiotics. Meanwhile, some of these things are not caused by what? The bacteria. They are not caused by bacteria. Malaria is caused by parasite, fluid, all of them virus. But you are taking antibiotics as a medication for it. You are causing what? A resistance. Another thing that causes resistance to antibiotics, that causes bacteria to grow resistance, is misuse of antibiotics. Misuse of antibiotics. You don't finish your antibiotics. A good number of us, you take the antibiotics the first day, they prescribe it to you. The second day, the third day, you don't take the antibiotics again. Some of us take today, our next is 2 days next is when we are going to take antibiotics. When you do that, and you are down with these symptoms, when you are doing that, what happens? You are growing resistance. You are encouraging resistance. Skipping of antibiotics, skipping dosage. Doctor said first in the morning, in the night, in the morning, in the night. But you yourself, you can take today and the next time is on Friday. You don't do that. When you are doing that, you are encouraging what? Antibiotic resistance. Leftover antibiotic. You don't begin your medication with a leftover antibiotics. You don't start treatment with a leftover antibiotics. You are done with typhoid, and the only thing you can do is to go to your drawer and pick up a leftover antibiotics. Come on, it's not a full dose. And when you are not taking a full dose, you are encouraging what? Antibiotic resistance. You are encouraging what? That bacteria to grow resistance to that particular antibiotics. Another thing that causes what this antibiotic resistance is what? Overuse of agricultural products. What is this agricultural product? Agricultural animal. Don't forget that antibiotics are being used to treat these animals, to encourage their growth. And here you are taking these antibiotics again through this animal. Am I saying that you should not consume farm product again? No, we are not saying that. But what we are saying is you minimize what the intake of this animal product. Another thing that causes what this antibiotics resistance is poor hygiene in the hospital, in our community, in our environment. Poor hygiene. When we are not keeping our environment clean, what happens? We are encouraging what? Resistance. And when you are encouraging it, these bacteria are used to the environment and they are growing what? Resistance. Somebody can be asking, if these are the cause of this antibiotic resistance, how did this bacteria fight back? Yes, they fight. How do they do that? There's what we call beta-lactamase. It's an enzyme, but these bacteria secrete these enzymes, these bacterial lactamase, to act upon these antibiotics. They attack these antibiotics. Thereby, these antibiotics cannot work again in the body. Even if when you have taken this antibiotic, the bacteria do what? Produce what we call an efflux pump. This efflux pump, immediately you are taking this antibiotic, the bacteria is bringing it out for you immediately. It's not going to be effective. And that thing they do is to change their binding site, the protein binding site. Bacteria does what? Change their binding site. When these antibiotics come, they camouflage and change their binding site. The antibiotic itself cannot see where to attack. These are the many ways that bacteria grow what? Resistance. These are the many ways bacteria combat and fight against the body system. So if we are talking about this, what is the clinical implication? How can this be a deadly situation to human being? Yes, it's very deadly because situation or infection or diseases that are meant to last 2 days or last 1 week is now going to last months if care is not taken. Your stay in the hospital is going to be lengthened. If you are going to stay in the hospital, If you are going to discharge you next week, you are not discharge because the bacteria, the antibiotics is not working. You are going to stay more. Now it's going to act on your finance, on your pocket, because more sophisticated antibiotics is more needed now. Because on normal, this bacteria or this issue is what you can take a small antibiotic to cure. But because your body have grown resistant to these small antibiotics, the doctor will now prescribe a huge antibiotics for you, and it's going to be acting upon what your finance, and you know how much antibiotics is. It's a critical situation, and not only that it affects your finance, is a life threatening. If the bacteria is not responding to that what antibiotics, what happens? It becomes a life threatening. That disease cannot be cured, and the person might eventually lose his or her life. That is the clinical implication. If these things are really what these antibiotics can do in the body system, how then do we prevent it? Just like the cause is. It's simple. Avoid overuse of antibiotics. Avoid overuse of antibiotics. Avoid the misuse. Don't prescribe drugs for yourself. Finish your dose. Don't skip your dose. Don't share your drugs. Don't share drugs. A good number of us share drugs. They take their drugs today and tomorrow. Next time they are giving it, take this one. I took it the other time. You are not doing, you are not encouraging, you are not encouraging yourself, you are encouraging what? Resistance. So when you avoid these things, you are what? You are controlling what? Resistance. You are controlling bacteria, what? The antibiotics, what? Resistance. You are controlling and you are preventing what? Antibiotic, what? Resistance. When you are minimizing resistance, you are controlling and you are preventing what? Antibiotic, what? Resistance. When you are minimizing what? This poultry animal that you do consume, you are what? You are preventing what? Antibiotic resistance. When you keep your environment clean, that's what we call nosocomial infection. These are infections that we get from the hospital. A hospital that is free from this nosocomial infection is the hospital that is clean. So hospital need to keep the environment clean. You yourself in the house, you keep your environment clean. Your community need to work to ensure that this antibiotics resistance is brought to an end. Antibiotics resistance is a life-threatening issue. And as such, all of us is needed to ensure that this resistance doesn't stand again. Thank you. Do well. If you enjoyed our class today, do well to turn on our notification button and subscribe to our YouTube channel. Please share the link to your friends so that they will understand that antibiotics is very deadly to the body system. If there is any life-threatening disease or infection that you want us to discuss, don't forget to drop it on the comment section, and we'll pick out from there and explain it and break it down for us. Remember, this is health breakdown. What we do here is to break down life-threatening infection and diseases. Thank you, and see you next time.